Fentanyl is an extremely potent synthetic opioid used medically to treat severe pain, especially after surgery or for cancer patients, but it also has high potential for misuse and overdose. The substance is about 50 to 100 times more potent than morphine, which makes it both effective and dangerous, particularly when used outside of a controlled medical setting. Some effects on the body and mind that fentanyl has on an individual. It acts on the brain and body primarily by binding to opioid receptors, which are part of the central nervous system. And then these receptors are responsible for controlling pain, reward, and other physiological processes. The effects on fentanyl on the body and mind are similar to other opioids, but are far more intense due to its potency. Some of the immediate effects it has are things such as pain relief, and fentanyl is highly effective at relieving pain, which is why it's used in medical contexts for severe pain mismanagement. It can also induce a sense of euphoria, which contributes to its abuse potential. Sedation and relaxation is also another one. Users often feel deeply relaxed and sedated. This is one reason why fentanyl and other opioids are abused. People seek these calming, euphoric sensations when using this drug. Also, respiratory depression. One of the most dangerous effects of fentanyl is its ability to slow down or even stop breathing. Opioids reduce the brain's ability to regulate the respiratory system, leading to respiratory depression, which can result in overdose and death. Constriction of pupils. Like other opioids, fentanyl causes the pupils to constrict, which is a classic sign of opioid intoxication. Nausea and vomiting. Many users experience gastrointestinal discomfort, including nausea, vomiting, constipation, drowsiness, or loss of consciousness even in high doses, when fentanyl can induce deep sedation when used improperly or in combination. Fentanyl use among college students is a growing concern, and the trends are shaped by a combination of factors such as accessibility, opioid misuse, and the proliferation of counterfeit drugs. Some of the key trends that have been observed in recent years are the increase in fentanyl-laced drugs. One of the most alarming trends in the increasing presence of fentanyl in counterfeit prescription pills such as Xanax, Oxycontin, and Adderall. These pills are often marketed as legitimate prescription medications, but they may contain fentanyl, often in lethal doses. College students who misuse prescription drugs may be unknowingly consuming fentanyl, putting them at risk of overdose. Evolving patterns of drug use. College students may be exposed to fentanyl through recreational drug use like cocaine, MDMA, ecstasy, and even marijuana that have been increasingly found to be laced with fentanyl. This has led to a rise in unintentional overdoses, as many students may not even know or expect that fentanyl is present in the substances they're consuming. With a lack of awareness, many college students may not fully understand the dangers of fentanyl or its potency. Fentanyl is far more potent than heroin or morphine, and even a small amount can be fatal. The misconception that counterfeit pills or illicit drugs are safe because they look real contributes to the risk. With a rise in overdose deaths, increasing presence of fentanyl in the drug supply, there has been a notable rise in overdose deaths among young adults, including college students. Fatal overdoses involving fentanyl are higher than ever before, with many of these deaths linked to the consumption of contaminated drugs.